Well, good evening, everybody, even though it said good morning. Oh, well. Welcome to our BioTouch Healing Health Condition Workshop on childhood ear infections. And my name's Paul.
Good evening, everyone, or good morning, whatever it is. This is Bev. Hi.
And we have a special guest presenter today. We have Dr. ReNae Strehlow, and she's a medical doctor, family practitioner. Welcome, ReNae.
Thank you.
Welcome, ReNae.
Hello.
Hi.
So she's going to give us a great presentation. She's prepared well for this. We have some nice slides to show with it. But first, we have even more important information. We have our secretary of the board of directors of the International Foundation of Biomagnetics just had a baby.
Hey, Kai. Congratulations.
Kai Cox, and that's not Kai there. That's her husband with the beard.
Matt, congratulations, Matt.
Yes, and that is their baby, Macy Amelia Cox. She was born at 10:04 a.m. this morning, and
Oh,
she was 8 pounds 15 ounces and 20.5 inches long. And from all the ladies I've talked to, they say that is big.
that's a strapping girl.
Strapping girl. And the other interesting thing is that baby was born on the date of her mother's birthday.
Oh, how cool.
Now, isn't that interesting?
That's
Congratulations, Kai. Congratulations, Matt. Congratulations to the whole
whole
family,
family.
all sides of the program. We're excited for you. So,
Oh,
and it was
yes.
all natural birth. It was a lot of biotouch in the midst of that pregnancy, and she had a doula who'd learned biotouch working with her. So, another biotouch baby is on the planet.
Yeah, that's great.
So here we are. ReNae, we're going to just have you just start talking about the ears and ear infections. And if anybody out there has a question, just type it in the comments and we'll relay it to ReNae. So take it away, ReNae.
Of course, the doorbell rings right now. The joys of doing this from home. But I'm Dr. ReNae Strehlow. I'm a family medicine doctor, have been for 30 years. I've seen a lot of kids along the way. So a very common reason for kids to come visit to the doctor is ear infections. Um, the most common causes are likely bacterial. There can be viral causes also. So sometimes you'll see this a lot when kids have a cold, but they can get it even without that. And I'm going to show a little bit about anatomy. We have a picture here just to help explain what's going on in the ear and why people are getting ear infections and also why the kids can get the ear infection so much. So if he has that picture for us. So they're seeing it now, right? Okay. All right. So if you look at the anatomy, it can be a little overwhelming, but I'm going to break it down. It's divided on the picture into the outer ear, the middle ear, and the inner ear. So the outer ear, as we all know, looking at our ears on the outside, but that also includes the canal that goes in until you get to the eardrum. The more technical term is called tympanic membrane, or we frequently will abbreviate it as TM, but that's your eardrum. So in the canal is the more common infections are when people get like swimmer's ear. People are familiar with that. And it's just an infection in the skin of the canal itself. Kind of a telltale sign on that is frequently it hurts to move the ear, and that gives us usually more of an indication that it's probably more of an outer ear infection, which is called Otitis Externa for external. So that's where you hear that term. Well, frequently when we look in the ear for that, you'll see can be a red canal, can be quite swollen. Sometimes it's even pussy. And different ways to treat that. A lot of times they end up needing antibiotic drops if it's that bad, if it's very swollen and red. Sometimes if it's just very mild, some people may get by with just some analgesic drops, using some Tylenol or Motrin for the kids. And because generally speaking, The sooner you can get it dry, the better, we find, because the longer it stays moist. Bacteria love moisture. They love nice, warm, moist spots to grow. And so you want to try to use, I generally use the antibiotic drops kind of for the least amount of time that I have to try to not have too much moisture in there. But they usually will resolve, quite easily. Sometimes if they're really bad, you might have to add oral antibiotics, but that's rare. Usually you can do it with topical drops or things for comfort. A big thing for that is sometimes people are prone towards that and kids are prone towards that. So you want to try to keep the canal dry as much as you can. Even using some, after swimming drops or something like that to try to keep the canal dry, or use earplugs, things like that. And trauma, that's a big thing. People are digging in their ear canals, and that's the way that people end up getting infection in there. So you do want to watch for that. But that's your otitis externa, as we call it, or the outer ear infection. So when you're looking at your picture, the next thing you're going to do is the canal goes, or the outer ear goes from the outside of the ear, like I said, to your eardrum. From the eardrum there's a little window that goes into the inner ear. That's called your middle ear. And that's where most of the infections are going to be that we're talking about, that are deeper inside. So you see it through the eardrum, or the eardrum itself being infected. And that's how you see more of the middle ear infection. But as you can see from the diagram, that's also where everything starts for our hearing. So you have the eardrum there. The eardrum has to be able to move well. It starts the vibration going for our hearing. So if you have fluid behind the ear, or it's infected, anything like that, of course, the eardrum's not going to move well. So that's why you start having, you can't hear very well when you've got an infection, and the kids can't. So sometimes in smaller kids, their symptoms or signs are going to be, a little bit tougher to tell sometimes on them. We'll go over that a little bit more, but that's where it starts, all the hearing. The eardrum, the little what we call ossicles behind there, that all start vibrating, and then that vibration is all transmitted through into the inner ear. So anything along that way that has fluid in it or infection is going to affect the hearing. As you go a little bit further, an important part, you'll see it's called the Eustachian Tube. And you'll see that kind of drains down in the bottom, towards the bottom. It drains to the back of the nose and throat, like way in that area. So anything that blocks that is going to also affect your hearing. So you might hear them talk about Eustachian tube dysfunction. And that just means that tube is not draining well. And our whole hearing system and everything is based on keeping the air behind the eardrum and not fluid. It's not supposed to be fluid there. So that Eustachian tube serves as a way to drain things. If it gets plugged up, you get fluid back up into the ears. That's a nice place for bacteria and viruses to grow. That's a nice culture medium, like a lab of growing this stuff. And kids, everything is smaller for them. So their Eustachian tubes are smaller. They have bigger, what we call adenoids, which you might have heard people talk about, tonsils and adenoids in kids. The adenoids are back there by the Eustachian tube area and all of that area. So if things get more swollen, they got smaller tubes to start with, they can be just much more prone towards getting infection. And that's why kids, they're more prone even up to 2 years old. Those are kind of the worst stages, like the 6 months to 2 years old, where they're going to get more infections. And luckily, as kids get older and everything grows a little bit, then they probably are draining things better. They don't tend to get infection with ear infections necessarily as much, except for the ones who are in daycare. And I'm sure everybody here has got kids in daycare who seem to pick up everything. So that can sometimes make it tough, because they will get a lot of recurrent infection. Very young babies, as you're talking about a newborn now, kids up to 2 months old, you worry about them more when they come with an infection, especially kids 2 weeks or less, newborns with fevers, ear infections, any of that stuff. they need to be more closely evaluated and look for a more serious cause of infection going on with them. So you do want to be careful in those really young newborns. Fever isn't good, and if they're showing any signs of infection, that needs to be evaluated. But I'm going to go back more to what we call the otitis media, and that's that infection in that middle ear. And that's where most of the infections are. We can't see the inner ear. That's too far in. All we can see when we're looking with a scope in the ear is the eardrum. And you're looking as far as the eardrum. That's all you can see. And we're going to go to some pictures of the eardrum, which we can put up now, I think, at this point, if you have those. And this actually it was a great picture from one of those home otoscope kits that you can buy, and more people are getting now. So that's where it's good to get kind of comfortable with, what does a normal eardrum look like? Because people are buying more and more of those kits at home. I mean, the kits to have at home. And they can look inside and look at the eardrum, which is great. And especially if you have a kid who's prone towards getting a lot of ear infections, that can sometimes save them a visit, because they can see in themselves and say, eardrum looks okay for now. I can kind of watch the kiddo that's got a fever and a fussy and things like that and see what's going on with them. But there should be a picture of what a normal eardrum looks on there. And as you can see, it's kind of pearly gray. It looks nice and clear. You can see the little bones protruding from behind it, the little ossicles. So that's all part of the hearing. So that's how it should look normally. And then when you get infected, as it shows on there, of course, it gets more red. You lose some of those nice, what we call the light landmarks. Normally you see a little light reflex when you look in there off of that nice normal eardrum. But when it starts getting infected and it's red, you lose some of that reflection. It can be bulging. And that tells you there's fluid behind there. There could even be pus behind there. And those are things you're looking for to indicate that there's an acute ear infection going on. I think there's also a picture there of a perforation, which is a hole in the eardrum. So if things get too bad, then sometimes the only way for that fluid to come out, if there's too much pressure behind the eardrum, is to get it perforates and it gets a hole in the eardrum. So then you'll see drainage. So anytime you see in a kiddo that there's something draining from the ear, you got to look and find out where it's coming from. If it's not a really bad swimmer's ear that's kind of weeping and making its own fluid and drainage, then you got to look and see if there's bad drainage in the eardrum or in the ear canal. There's most likely a perforation, because in terms of how else it got there, if it's not an infection in like a swimmer's ear. So that's a more, we don't like to see that, because that over time, if you keep perforating and you keep scarring that eardrum, you can start thickening it, that could affect hearing down the road too. Plus, if it's such a bad infection in that middle ear, you've created a lot of pressure. There's a lot of, pus around those tiny ossicles that are supposed to be moving and vibrating so that we can hear things. So over time, if they just keep getting a lot of ear infections or a prolonged untreated ear infection, then we do worry about, some effect on the hearing. And also on that picture, you can see it says PE tube or ear tubes on it. That little white plastic ring. That's for the kids who get a lot of ear infections and they have tubes in their ears. That's what that is. Is it just as a way to relieve that? They can drain if they need to, and sometimes then it's easier so they don't keep getting so many ear infections, because they don't have that constant buildup of fluid and all that. The fluid, that's a great place for bacteria and infection to grow in. So those are kind of nice pictures as far as what's going on in the eardrum as I'm talking more about the infections here. So as I said, we're going for the glasses now. That the middle ear is where most of the infections, and we call it otitis media. If you're going to pick up, most of otitises are for infection. So you had the otitis externa in the outer ear. This is the otitis media in the middle ear. And that's most of what people are going to be talking about when they talk about ear infections for kids or anyone. And they now designate it as acute otitis media. So that's the more infectious type of otitis media or ear infection. Because some kids look at it, and even adults sometimes, if they've just had these chronic infections, they just have this chronic fluid behind the ear. And sometimes it can get really like gelatinous. They'll call it like glue ear or things like that, where it just has been there so long. And that's really hard to drain. I mean, it's not going to drain well on its own. So that's where a lot of times, the ear doctor's got to do something to try to get that chronic fluid out of there. But luckily, that's not the majority of what you see. The majority of what you see is the acute otitis externa, those red ears, like I was showing on there. Just for a few things, not to bore people too much with statistics, but just to realize how common this is by 3 years of age, 50 to 85% of children will have at least had one episode of acute otitis media. So it's very common. In the younger kids and the babies, you're going to maybe some of the symptoms can be, as we all know, the rubbing and tugging, holding on the ears, things like that. It's bugging them. So they're letting you know that there's something there. They can have a fever, be irritable. Sometimes you'll see the discharge. Younger kids, they'll lose their appetite. They don't want to feed. Sometimes they're vomiting or appearing lethargic, very tired. What we're looking for when we go is that along with those symptoms that you see some of the redness in the eardrum, if you see it very severely bulging, there's an infection there. The new drainage, like I said, if they have anything like that, or if they're very intensely red, those are all symptoms to indicate there is an infection going on. Now, in terms of treatment, when I started out, way back, pretty well kids were just put on antibiotics, early on, because the fear was always, if we let it go, then they're going to get more serious infections, because you worry about what they call mastoiditis, which is the mastoid that's back here. So if kids are having like bad pain, complaining of bad pain behind the ear, and they've had a bad infection, then that's where you're worried that that's gotten deeper into the bones around the ear area. So we used to try to kind of worry about that more and think that we wanted to try to prevent that, but it's changing more now. The recommendations are more towards waiting a little bit, because a lot of these are going to resolve on their own without antibiotics. And you don't want to have the risks of the antibiotics if you don't need to. A lot of kids, it can be rashes, diarrhea. They all seem to react to the antibiotics. Also, you don't want to kill off all the good bacteria, in the gut, because that is very important for our overall health and in trying to prevent more, like I said, the diarrhea and such. And also we'll get more and more resistant to the antibiotics if they're used so quickly. So in general, all of medicine for many things, and including for kids, is trying to hold off on antibiotics if we can, so we don't have the resistance build up where the bacteria get more and more resistant to it, because they're trying to survive too. So they're trying to figure out ways to not be killed by the antibiotics. So in general, watch it a little bit more, so people can do more of the things to try to make the kids comfortable, and if they need to use like Tylenol or Motrin or something like that to make them comfortable. Sometimes heat can help. There's controversy how much it does. I'm kind of like, whatever makes them, feel more comfortable, we'll go for it. And so we try to hold off a little bit more on that, where they'll watch them more, because they found that actually 80% of children will resolve without antibiotics. So versus 93% with antibiotics within like 3 to 5 days. So you can wait a bit if you've got a reliable patient, reliable parents. Eardrum doesn't look that bad. They aren't that sick. You can give them a little time to try things for comfort and less invasive ways of treating them, to see if they will improve on their own and not need the antibiotics, and whatever you can do to try to make them comfortable and such. Because when you do have to, if you do decide you have to use the antibiotics because they're not getting any better, they're getting worse, they're having much more pain, they're getting higher fever, especially, infants and stuff, and they're not eating and all of that. And you're the parent who's been up for 2, 3 nights in a row with the sick kid, then it starts getting a little bit more, well, maybe we do need some treatment in there. So the most common antibiotic, people I'm sure are very familiar with, amoxicillin, and it's still used as first line for most kids, as long as they're not allergic to it and they haven't recently been treated with it and failed it. So we do use higher doses than when we first used to start. So as you can tell, even over the years, even though it still works, the bugs have gotten more resistant to it. You got to use higher doses to get it to work. So like I said, we are holding off on that a little bit. And basically right now they're recommending for children from 2 to 12 years of age with non-severe symptoms that it's reasonable to observe them if you can trust the observation, trust the observer, and trust that they're going to, be brought back in if they're getting worse. So it's become, like I said, a little more tempered as far as how we're treating and not rushing in to use the antibiotics so much, and see if they will resolve some on their own and not give them the side effects of vomiting and diarrhea and a rash and all the other things that they can get. Because they found that in general, even without using the antibiotics, they found that it caused less pain. None of them improved with less pain at 24 hours. So it is okay to wait. They aren't going to get instantly better, overnight with or without the antibiotics. So you can watch them a bit and see how they're doing. They actually found that none avoided recurrence of infection or hearing loss at 3 months when you do the antibiotics. So it's kind of like if they're going to get recurrent infection, it can still happen. Even though you treated them for this infection with antibiotics, it doesn't mean they're not going to get another recurrent infection. And also that the risks of the hearing loss perhaps aren't as severe as we used to think, that you're going to put them on antibiotics, you're going to prevent them from getting hearing loss. That they still may get that just because of the nature of the beast with the infections. That if you gave them antibiotics, only 1 in 33 avoided a perforated eardrum. Still, for me, if it's my kid who's the one, that I guess that does make you want to perhaps be more aggressive. But just in terms of not, they're not all going to perforate the eardrum. There's going to be, luckily, a fairly low amount that will. And that even those serious complications of the mastoiditis, which is the infection into the bone behind the ear, or a meningitis where it has spread up into the brain, that didn't seem to really be related to giving them the antibiotics early on. People that were at risk for getting that and could still get it. Whereas 1 in 14 of kids developed vomiting, diarrhea, or rash. So, it's a pretty high amount that will get the side effects from the antibiotics. So that's why you're trying to be a little more cautious if you can, and not feel like, that you're gonna prevent every complication, if you give them antibiotics. That observation and close follow-up is really the key to see if they're getting worse. Then, of course, they need to come in. So a couple things as far as some of the risk factors for like who are the kids that are going to get this more. There's a lot of things that we can't change. If they're younger than 5 years of age, they're more prone towards it. If they have any kind of abnormalities of their face or what we call craniofacial, but anything in the face, of course, that they have some type of anatomy problem that could make them more prone towards getting infections. If there's a family history of ear infections, they can be more prone towards it. If they're a low birth weight or a premature baby, say less than 6 pounds, low birth weight, they're higher risk for infections. Males are higher than females. Again, a premature birth weight or a premature baby. If they've had prior ear infections, if they've had a recent viral cold, we see this a lot around with cold too. White babies are actually more prone. So white males are actually the highest prevalence of ear infection. And obviously none of those things that we can necessarily change. Things that could possibly help that we can change. One is secondhand tobacco smoke may be a significant risk factor, and certainly it's a risk factor for many other things for children. So that's really something to focus on if anyone in the household is smoking. It really puts the kids at higher risk for ear infections, asthma, just overall issues. And anything that's kind of a crowded living condition. So of course we see more when it's cold and everyone's inside. Lower socioeconomic levels, daycare, school, but around a lot of other kids. They put everything in their mouth and touch everything and, and bring it home to mom and dad too.
Yeah.
Reflux. So you have some kids that do have problems, the babies who have the reflux, the acid reflux all the time. Anything like that is higher risk. Just because, as we talked about with the anatomy, when you have those Eustachian tubes that are draining into the back of the nose and the throat area, anything coming up is higher risk to get into that Eustachian tube. And that Eustachian tube it's a nice path and canal back up into the ear. So it does serve as a nice freeway up into the ear. Also, breastfeeding can help. So lack of breastfeeding may put them at higher risk. Even breastfeeding for up to 3 months can help significantly. If they can breastfeed up to 6 months, it can reduce the incidence by 43% for ear infections. So breastfeeding is very helpful and important if they can. Not everybody can, and some people it just doesn't work well for different reasons. But if they can use it, it is one other benefit of breastfeeding. Also, using a pacifier after 6 months of age may possibly worsen. Some of the data is kind of iffy on that, but it's felt that the prolonged pacifier use may aggravate. And if they never get ear infections, then you don't have to worry about it. If they're a kid who's getting a lot of ear infections, then that may be something that you want to look at, because if they do get a lot of ear infections, most parents are wanting to look at anything that might help not having to keep getting these infections, because it's miserable for the kiddos and it's miserable for the parents when they have the ear infection. Yeah. So and the other thing, to try to avoid the bottle propping, to not have him laying so flat and then propping the bottle up for them to feed. That also, as we talked about, just the anatomy. You can imagine if everything's going back in there, then that may make them more prone towards infection. So a couple other things just in terms of helping or not helping. I commented on the handout that the topical anesthetic eardrops and some of the naturopathic eardrops have been found to decrease pain in some small studies, but there isn't overall evidence to, there's not sufficient overall evidence to necessarily recommend that routine use. So it's one of those things, sometimes people will try. If it helps, it helps. If it doesn't, then don't keep using it. They should be avoided, though, if you have any concern of a perforated eardrum. So if there was drainage before, don't put anything in there, because it's just going to go back through the hole in the eardrum and potentially cause more problems, because, other chemicals and foreign materials are not intended to be in that middle ear. So you don't want to put those in there. And in general, from a scientific thing or studies, there is limited evidence of benefit of home remedies, such as the heat or the cold or the oil drops and stuff. But sometimes people will try it. It's worth a try and see if they feel better. If they don't, or that aggravates them more, then it's certainly not worth doing. And then I mentioned, so other options would be discussed by Biotouch to describe or discuss some other options that you could try. But I hope that wasn't too overwhelming, but I was just trying to give you some ideas of, how common these are and things that
Right.
we're looking for from a medical standpoint when you come and bring the baby in or the child in. If it's just a little pink and they're a little fussy and, not bad, then try to avoid the antibiotics if we can. But, if they come in and they've got a raging red bulging ear that looks like it's about ready to perforate, and we see those and they're miserable and they're running a high fever, that's going to be the one that you're going to be inclined to give them an antibiotic, because it is generally,
Right.
it's hard to tell somebody to just take your kid home when they're miserable and it looks bad, and to try to prevent something from happening if you can. But if they're not bad, and you have to sometimes look for other reasons why they're fussy, and see what else could be causing it. I did want to mention one thing in the anatomy when we were talking about the inner ear, which is way inside, is that's also where a lot of our balance system is. So when they say that you have an inner ear infection, and luckily kids don't seem to get this that much. That does happen more with adults. We have more things that happen to us because of aging in the inner ear. But that's where people can get dizziness or vertigo, the room is spinning type thing. That's more the inner ear. That's further inside. But luckily, like I said, kids don't tend to seem to get that too much. But dizziness or vertigo, it can happen with ear infection.
Good to know.
So I think that's probably most of the points.
That was
that helps.
Yeah, it does. We had a few questions, but one of them that seemed important was, can chronic allergies cause ear infections?
Yes, it could, because when we're talking about the anatomy, anything that makes you congested up here and blocks that Eustachian tube can make you prone towards getting infection.
Wow.
Now, the allergies probably not so much itself as far as the ear, it's just that it's causing blockages.
Right.
And people get a lot of sinus problems, and kids who have a lot of sinus issues and the nose. That's why even like if the kids will let you do it, some of the saline lavages, we do those for adults too, where use more of the saline rinse, because if you can rinse this out and keep the sinuses open, you're going to have less stuff go up into the ears too.
Interesting.
Okay. Wow.
That was great.
Dr. ReNae, that was awesome. The pictures worked well. A few people said that was an awesome, great information.
Yeah.
And you've just given us some more information too in relation to how we're going to present Biotouch here in the second half. My brain's just like, oh my gosh. Yeah. So, oh my gosh, we appreciate that. Thank you so much. And I hope that you enjoyed it enough where maybe you'll come back again for another one of our little health condition workshops. You're a great presenter. We appreciated that.
Thank you so much.
Well, you're very welcome. Everybody have a good evening.
All right. See you later.
Thank you, Doctor.
Bye-bye.
Bye.
All right. Well, that was a trip and a half.
I had no idea. I had a son that had ear infections every time I turned around. I knew nothing back in those days, evidently. Well, I always say I wish I'd had Biotouch. Holy moly.
Well, and I think that's what we're going to present here. We're only going to share with you a few sets of points.
Yeah.
One that we didn't put into the manual is the sinus.
Yes. The moment she said that, I wrote down sinus. Oh,
man. So we're learning all the time. This is great. But, I'll tell you, the greatest part of her presentation was just observe for a while.
And do Biotouch.
Yes.
While you're observing, do Biotouch.
Because that, she's giving you the 2-3 days to just watch it. Don't jump to the doctor. You don't have to go rush and get an antibiotic. Just watch, and it could cure itself on its own. Well, and Biotouch is not going to hurt. You're not putting anything in. She said, be careful of the drops. I mean, there's nothing finer than doing Biotouch for ear infection with children. Oh my gosh, we have a great system here. So it's amazing. And I just, let's just teach the points. I'll give you a little thing that another doctor that did it with his child. So we're going to let Bev take you through the little workbook that we have. If you want to look it up, you can go to justtouch.com/workbook. You can download it right away and follow it with Bev. And that will also have the links to the video we're going to show you here. And Bev's going to take you through it. She's also going to explain a little about BioTouch for those of you who are here and have never even heard of what BioTouch is. So take it away, Bev.
I did want to thank you, Paul. I did want to mention that if you want to get our workbook on childhood ear infections, it's really a wonderful small presentation that we've put together for you. The first page always gives an overview, a synopsis of what that health condition is. So it just kind of opens the door, and then there's okay, good, yeah. So yeah, it just, begin with that. And so we're going to go to page 6 from our manual. And we're just going to kind of go over some general information for you. And like Paul said, if you're new to BioTouch, here we go. So what is BioTouch? Well, it is a very light touch using the first 2 fingers of both hands, and you're touching very lightly on the skin, what we say like a butterfly. And its definition, one person touching another person lightly on the skin. This is the definition of BioTouch. We always get, of course, those questions. Can you do it on yourself? Well, boy, have we been going over that since this pandemic, haven't we? Just by definition, that's not BioTouch, but, we always say, well, if you can reach those points in that set, then, we don't know. It could help and it could not. So we're very neutral on that. That's, up to you. We just don't call that BioTouch. BioTouch is, first of all, a relationship between 2 people. Practicing this really wonderful, powerful healing technique. So let's begin by, there's 4 bullets on page 6. We'll just kind of quickly go over each. It kind of gives a synopsis of everything. So we always say BioTouch is easy to learn. There's 17 sets of points in this technique. The manual is amazing. We have a manual and a DVD that you'll see as we go along with the sets of points we're going to present to you tonight, that explains, you see the one side on the left, which is a diagram of the body, that part of the body with the steps to follow in those sets of points. And then on the right-hand side is a written explanation of how to find those points. So BioTouch is a language of its own. It uses a specific language. You don't have to know anatomy. We, for an example, that we call that big bone at the base of the neck, which we use that as a guide to certain, finding certain points and sets. Well, in the medical world, it's called the C7, but we call it the big bone. So anybody can use BioTouch because the language is just, well, I guess for the layman. You don't have to have any special education. So that's why it's easy to learn. Yes, and we have had children. In fact, that's the beauty of BioTouch. That's the most amazing thing about BioTouch. Children can learn this just like an adult. I mean, it's just amazing to me. You can turn around and show your child how to do a set of points on you or on grandma or the neighbor down the street, whatever, and they know it. It's kind of like this innate child in all of us. That's what BioTouch is, kind of holds. It's just a safe, non-invasive, very powerful way to care for another person and address their pain and their stress. So it's a complement, we say, to any healthcare program. Well, we've started using other words. It's totally integrative. It is a holistic system. And because it's non-invasive, it complements everything. Whether you're on a special diet, whether you're under a doctor's care, whether you're doing other modalities, BioTouch only enhances what you're already doing. And it's very safe. So you can use it in conjunction with everything. There's no levels of learning. Everyone is immediately effective when they learn BioTouch. And this is one of the most beautiful gifts of this technique. It is meant for every single one of us to learn and to use in our lives, with our families, with our friends, with somebody you're sitting next to on the airplane. I mean, it's just the most human technique. It's very unique in that. So everyone's effective the very first time. After tonight, when you learn these sets of points for ear infection, if you happen to have somebody in your life with an ear infection, I guarantee you, you can turn around and use those sets of points for this person and something will change. You will be effective. Paul's been doing this for 30 plus years. You'll be as effective as Paul is. And that's saying something. Let me see. And then the last bullet, there's no sense of preparing yourself to do BioTouch with somebody else. You don't have to, clear or cleanse or prepare. You can do music, you can do lighting, that's fine if that's what you want to do. But the beauty about BioTouch is you meet that other person in whatever environment you are in with that person. You don't have to, be centered or anything like that. This is a human relationship with another person. And so your state of mind doesn't even matter. You can be having a really bad day. The moment that you touch another human being, boy, all barriers begin to break down. So that's basically what's going to go happen with BioTouch when you start practicing this. We always want to let you know, what it is and how easy and simple and beautiful it will change your life. So here's the process before we start doing it. You always want to wash your hands. You're always going to use the first two fingers of your hands. You're going to touch very lightly on the skin, like a butterfly. And those sets of points that we're going to teach you, you want to hold them at least 6 to 8 seconds. And that's it. That's it. I mean, here we go. So Paul and I, we always go through and we look at the most basic sets of points that you can use to address a health condition. And so that's what is presented in our workbooks. So let's begin with the greeting. Am I going to be seeing the video, Paul, or just them?
They'll see the video. So there's the greeting. Now we did show the terms, but those aren't necessary to know these few sets of points. But we'll just go ahead and show the greeting to the folks, and then we'll come back.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be re-established. Then the session may proceed from where it was interrupted.
Okay, and I just want to reiterate that the greeting is always must be performed before any other sets of points are addressed to the body. This is the key. It really establishes a harmony between the one who is giving biotouch, the one who is receiving biotouch. This is that perfect relationship of healing that we enter into.
And the nice thing about that one too was that the son was there with his
Yes.
parents doing
There you
that
go.
greeting.
So, you know, our part of our vision is to get biotouch into as many families in the world as possible. And when I see that picture, it just reminds me of what's possible. Yeah. Okay, so we're going to go to the ear set, right, Paul?
No,
Is that
infection. We have infection.
Oh, we did. Okay, see, I don't have that in front of me, so
Right.
you have to kind of
Infection,
guide me.
allergy, infection,
Okay.
allergy, and poison.
Infection, allergy, and poison. Well, you know, it was interesting because they were asking about the allergies. So hey, why not use that whole set, not just infection, but yeah.
The infection, allergy, and poison sets are 3 separate sets of points. They all share the same hold point, which is the same as greeting point 1, located in the fleshy area just below the base of the breastbone. As with all sets of points, these may be touched repeatedly. Infections of any kind anywhere in the body may be addressed by holding X and with the other hand touching point 1, which is at the base of the large muscle on the right side of the neck and slightly above and behind metabolism point 1. Allergies or allergic reactions may be addressed by holding X and with the other hand touching point 2, which is on the right side of the neck, directly behind metabolism point 3 on the top of the large muscle. To address poisoning within the body, hold X and with the other hand alternately touch point 1 and point 2.
So simple, but very, very effective.
And I think what's important too is even if you're taking an antibiotic,
Yes.
having this set for the poison set will help the body not accumulate the side effects of that antibiotic.
Yes, that's a great point. Yes, so all 3 of those are really, really great to use. Definitely. Now we're going to the ear set, which addresses all of that infection and loss of hearing. What else? Yeah.
That what was nice when she showed the ear, the whole ear, the inner, the middle, and the inner and the outer ear.
Outer.
And this ear set, it doesn't matter where the infection is in there, and you're not probing and things like that.
Right.
So
yes.
Again, it was so inspiring to listen to her in relation to biotouch.
You know, that brings us back to so I was thinking about this when she was actually talking about all 3 of those. And I was thinking, oh, the body knows where the problem is. It doesn't matter if you're just doing it it will use it to address what's out of balance for it. So yeah, you don't have to dig your fingers in there or anything. Yeah.
All right, let's show it here.
The ear set may be used for any conditions affecting the ears, including problems with balance and equilibrium. Step 1. On one side of the head, hold at X, which is just in front of the flap at the opening of the ear. On the opposite side of the head, touch points 1 and 2. Point 1 is at the indentation in the bone behind the ear, about 1/3 of the way down from the top of the ear. Adjust the fingers to be snug against the skull. Point 2 is a small indentation at the bottom of the ear directly behind the jawbone. Again, adjust the fingers so they are snug against the ear. Now find hold point X on the other side of the head, and in crossfire touch point 1, the indentation in the bone behind the ear, about 1/3 of the way down from the top of the ear. Then touch point 2, the small indentation at the bottom of the ear directly behind the jawbone. Finally, for step 2, in matching fire, touch points 1 and 1, 2 and 2, X and X.
Boy.
Again, what's great, a mother-daughter. you
Yeah,
know? I mean,
right.
it's like,
I know. And just those 3 sets, boy, you're going to be able to address much of what Dr. Strehlow was talking about this evening. Biotouch,
Right.
non-invasive, but very, very effective. Yeah.
we can't encourage you enough to learn Biotouch.
Oh,
When I listen to the medical profession, and like she said, she even talked about homeopathy
right.
and drops and saline. She says, there's no clinical data for it. Well, but she was very open to people trying different things. And with Biotouch, we know there's no side effects. You can't hurt anybody with
Yeah.
Biotouch. So
Yes.
you've got nothing to lose by learning these points, doing them. It can only help.
It can only help.
And I was.
And
Go ahead.
I'll say it again. If I had Biotouch when my son was young with his ear infections, oh my goodness.
Yeah.
What
I'll
were
tell
you
you,
doing?
we had a doctor up in California when we went there to open up a center. His son used to get 3-4 ear infections a year. He was going to school, just like the doctor,
Yep.
ReNae was saying. So he had learned Biotouch, and he did the ear set on his son. Lo and behold, the next season when he usually got those ear infections, his son didn't get a 1. Not a 1. So,
Well, do you expect me to say I'm surprised? I won't.
So, I
Come
love
on.
these health condition workshops. I mean, they inspire me to really want to get this into your home, into your
Right.
family, into your hands. You've got the
Yes.
ability.
Yes.
Yes.
You've already got the tools. You've got the tools. They're right. They're called this.
Yes. So we are here to help you be inspired to use this in your life.
Right.
You can download that workbook for this month for free. justtouch.com/workbook. If you want to become a member, you can get the entire ebook with links to those videos that you just saw, and then you get all of our workbooks. There's almost 50 of them now.
I know. Wow.
And if you're here and you missed some of our other health condition workshops, go to that little bar up on justtouch.com where it says health conditions. Pull some of them up, and you'll see there's about 50 of them up there that have other health condition workshops that we've done before.
Right.
So we always try to keep them in an hour. If you know any massage therapists who want to take it, they get a CE credit for sitting with us for this hour. So let us know how we can help you, folks. Next month's workshop, they're always on the 4th Thursday of the month. So the next one will be March 23rd, and we have a really awesome guest for that one.
I think so.
Yes, Dr. Zagul from Dubai.
Dubai, yes.
He works with children with autism, and he is going to share with us. In fact, we're going to tape him before because the time difference is so different.
Yeah.
But we are looking forward to his presentation.
That's going to be a good workshop.
Yep. All right, Bev, thanks. You did a great job tonight.
Appreciate you, Paul. Same to you.
And thanks to Dr. ReNae. Congratulations to Maisie Cox, who's now in the world with us.
Welcome to the planet, Maisie.
Yep. So good night, everybody, and we'll see you all next month, or tune in on Mondays with Bev and Paul at 10 a.m. Tucson time.
Yeah.
Take care.
Good night. Thank you.